All right, I'm gonna go out on a limb here and assume that I'm pretty sure about every single one of us has had a doctor's appointment that went something along the lines of, okay, so we're gonna do this test or we're gonna start this medication. And then you're sitting there thinking, wait a minute, when did I agree to that? And it's not even malicious, typically. Most providers have already gone through their mental flow chart, their medical decision making, the whole diagnostic tree, and they've landed on what they think is best for you. But when you're left out of that decision, it hits different, doesn't it? You feel like things are happening to you instead of with you. That's the part that makes people feel powerless and less inclined to follow through on those medical decisions. Hey, no judgment here. I'm the first person. If you tell me what to do and not why, you can bet I'm probably not going to do it. But then when you add in the speed of modern medicine, where appointments are short, everybody is tired and overworked, and the whole system is running on like a factory with sometimes broken guardrails, patients often end up on autopilot too. They just nod because we've been conditioned to. The doctor knows what's best, right? Well, not always. I mean, they're human, they're fallible, and the decisions that they land on are influenced by their life experience and their values, which is not always the same as yours. I learned it pretty early in my career, and I've seen it play out in so many different scenarios. Recently, I had a client whose doctor wanted to order a very specific type of CAT scan, one that required another IV, contrast, and another copay. But I was listening and he said, "Okay, here's what we're gonna do." And I said, "Well, hold on. Didn't she have that type of CAT scan a month ago in the ER?" And he said, "Yeah, but the report didn't mention the arm vessels that we're looking for." And I said, "Right, but the imaging would have captured them even if the radiologist didn't comment on them, right?" And he paused and he pulled up the images, and sure enough, there was exactly what he needed. That one little question saved her another scan, another bill, and a whole lot of stress. It didn't really change her medical outcome, but it did give her some agency back. And once you see that play out, you really can't unsee it. And for me, anyways, that has become the standard of how appointments and how medical and patient teams should run. Now, that's something that I was able to come up with right off of the bat because I have training for this sort of thing. But I have some strategies for you to be able to also see some possibilities when you're presented with just one. Because there's always at least two options, right? The do or not do. I mean, heck, even when somebody dies, there's still options, cremation or burial. So if you're only being presented one, you just have an incomplete picture. And I've got a five-part framework to help you collect the other data points that maybe have just gotten shuffled through the process. So, one of my favorite tools is the brain framework. Now, I believe it originally came from the labor and delivery world, but honestly, it should be taught to every patient in every medical specialty because it gives you a framework and language to slow down the conversation and remind both parties that this is a partnership, not just a protocol to be executed onto somebody. So, what do I mean by brain framework? Brain is an acronym, BRAIN, and it stands for benefits, risks, probably the two things that you're familiar with regard to medical decision making. But then there's also alternatives, intuition, and nothing. So, allow me to dive into those a little bit. B, benefits. Start with, can you walk me through the benefits of doing this? You're not being difficult. You're getting clarity. Sometimes the benefit that your provider is seeing may not even necessarily be a benefit for you, but it does help you to understand the rationale for why they are proposing this next step. It helps you to understand why the provider thinks that it makes sense. An example of this would be, what is the benefit of doing this scan now? Another way is, what are we looking for? Or what is the intended outcome? Next, ask, what are the risks? Every medical decision has trade-offs. I, and the benefits should outweigh the risks. But again, everybody's risk tolerance is different, and things that seem like benefits to one person might not be for another. So, for instance, when you start hearing about the side effects, possible outcomes, or if we're talking about a surgery, what recovery looks like, then you can better weigh those against your personal values and actually get a true risk to benefit analysis. Oftentimes, I hear surgery talked about with patients, and the risks mentioned are things like the risk of anesthesia, the risk of bleeding, and the risk of infection. Those come along with every surgery. That is not a very informed, that's just the bare minimums. Like that has nothing to do with whatever that individual procedure is. So make sure that your provider is talking to you about the risks that are specific to that intervention that they're mentioning. Now, the next three that you probably haven't heard as much about, alternatives. This one is my favorite. Actually, I think intuition is. Anyways, um, ask what are the alternatives, or is there a different approach we could try first? I find that this tends to be very valuable when followed up with why. For instance, first thing that comes up for me is I have two kids, and I did not want an epidural with either of them. A lot of people think that's crazy, but me personally, I know that I tend to be very sensitive to medications. I also tend to get all of the side effects. So while epidurals are, pretty common and typical for almost every laboring woman here in the US, for me, that risk to benefit ratio, I really felt like the risk was higher. So I started digging into alternatives. And fortunately, I found ones that worked really well. But sometimes there's just creative problem solving. And oftentimes, reflecting this question and asking about alternatives kind of can snap your providers out of autopilot. Honestly, I hate to say it like that, but healthcare, a lot of healthcare has been, almost all of healthcare has become very protocol driven. So you get a diagnosis and you just pops up this list of like, oh, well, here's just all the next steps. I don't know about you, but check boxes don't always fit me. And so asking about these alternatives, it kind of shifts that provider's brain from just going down the steps to actually engaging in critical thinking again. And when we simply ask about alternatives, that's not that that is typically not received as controversy or, being difficult or anything like that. For example, instead of a CAT scan, can we try an ultrasound first? It never hurts to ask. And you'll either get an answer of, oh, sure, actually, that's really reasonable, and I hadn't thought of that. Or, well, no, because. So either way, either you're getting options or you're getting data that helps to confirm that now we see why that path that was presented first was presented. Because sure, there is this alternative, but the benefits are much lower. And now you've become informed in this journey and you were part of the process. And these things aren't just happening to you anymore. Often this one can open up a whole nother path. The fourth piece of brain, of course, is the letter I for intuition. I want to pause here before I lose you or you roll your eyes. We've been kind of conditioned to downplay the importance of intuition. But really, what neuroscience and psychology has found is that intuition is actually your brain's way of recording memory that can't be stored via language. What do I mean by that? So when we have a memory stored and you think back on a memory and you can visualize it, you can hear what people were saying. Sometimes you can even bring up smells or touch, taste, all the senses. That a memory like that, that's fully realized with all the senses, particularly that you can put language around, is think about it as being like a lot of gigabytes. Like it's a big file to save on your mental computer. And you can't possibly store every single thing that has happened in all your life in that large data file. So, what the brain does, knowing that life experience is very valuable, um, some things that don't fit into the large brain file get compressed essentially. And so that event, instead of being stored with verbal language that we can recall, gets stored as a feeling. And when something comes up that triggers our brain to recall that previous event, that the pattern recognition says, "Ooh, I've been in a situation similar like this before, and that outcome was either, good or bad." That's where that gut feeling comes from. It's based on previous life experience. It's not just a random feeling, and it shouldn't be, you shouldn't try to explain it away. I really encourage you to lean into it. That is what intuition is, and it's vastly undervalued. But I don't know about you. There's not been a lot of times where I've listened to my gut and regretted it. However, sometimes it can be very tricky, because a lot of times we don't have anything more than, well, I just have a feeling that, A is the better fit for me, and we can't explain it. Um, but the other side of that is you really don't owe anybody an explanation for what you know is right for you. All right, I'm gonna stop being woo. Um, oh yeah, that's right. I had a note here I want to make sure I share with you. If something's sitting wrong in your body, it is data. Your intuition doesn't need to override medical reasoning, but it does deserve a seat at the table. All right. Finally, step 5 of this framework, the N stands for nothing. Ask what happens if we do nothing, or if we don't change what's here. And sometimes do nothing doesn't mean do nothing forever. Maybe it's, can we pause this for an hour so we can think through everything if it's a time sensitive situation? Or sometimes it's a wait and watch approach. Now, side note, I don't typically recommend that a wait and watch approach be a first line decision for things, but it is one to be considered. There is a time and a place where it's appropriate. So, again, going back to understanding and asking the questions around how do we arrive to this recommendation will help to reveal, oh, well, in this situation, doing nothing, the risks of doing other things outweigh the possible benefits. So, maybe doing nothing is the best choice. Sometimes, the body just needs a chance to respond to previous interventions before we change things up. I've seen this a lot with medications, particularly psych medications. Um, Oftentimes a do nothing approach can be better there, as psychiatric medications tend to have a ramp up and ramp down, and changing them too quickly can actually be more harmful than beneficial. Again, this is why we say this podcast is not medical advice, because there are, just so many layers of nuance and variables around this. And that's exactly why you need a framework like this for medical decision making. When you combine all 5 of those pieces, benefits and risks, but also alternatives, your intuition, and nothing, you suddenly have a framework that, the reason I love this is it's not disease specific. This isn't something that can only be used in L&D or only be used for someone having a stroke. This is just a helpful tool for guiding conversation with any provider. And when you practice saying it out loud, just one letter at a time, it starts to become second nature, like muscle memory for your medical decision making. Because here's the truth, when people have agency over decisions, even in the middle of something life-threatening or terrifying, they cope differently. We actually know this from studying PTSD and the way that a person either being in action or being powerless in a situation impacts whether or not they develop a post-traumatic stress disorder from that event. And it's something that I've seen play over and over in ICU. You know, Unfortunately, a lot of people who go into ICU, they don't make it back out. And the pathway to that end result is, of course, very difficult for them. And I'd say even it can be even more so difficult for the families who are being asked to make those decisions, especially when they're not exactly being asked to make decisions. I've seen too many times where providers, think that they're trying to use comforting language and say something along the lines of, I'm sorry, there's nothing more that we can do. And, it does sound very compassionate because you're relaying to the family that you've tried everything. But really, I think a lot of the way it's received is that now the family feels powerless in that situation, that there's no other choice. And I always took a slightly different approach with my patients. And unfortunately, I've had to have these conversations with some of my clients' families too. And, the truth is, there is another option. When your providers are talking about end of life care, it's, typically in the setting of medical futility, meaning that the team has sat down and everybody medically involved with that patient is looking at everything and going, no matter what we do, the outcome will be the same here. And the kindest thing we can do for this person is to give them a peaceful passing. Believe me, I get that. That's a core value of mine too. But I don't think we should be presenting it to families and telling them that it's the only option. I don't know if somebody walked up to me and told me that there's no other option for my mom but to, take her off life support, I would question that. I mean, that's just kind of a knee-jerk response. What do you mean there's no other option? What do you mean you've done everything? But how I like to handle that with people is to explain the situation, the thinking, the decision tree that went behind that, what we're seeing in the patient, what it'll look like, what if we do nothing? And in that sense, continue doing what we're doing, keeping them on life support. What does that look like? Well, the risks of infection are going up and they're already fighting infection. These medications that we're using to keep their blood pressure up, it has all of these long-term side effects. In fact, we're starting to see some of the issues here. Look, and I do my best to explain every facet and every piece of what the team is seeing where all signs are leading to futility. And it's never a fun conversation. But when we share I share information like that with my patients or my clients and show them what this path looks like and what this path looks like, now they have that choice in their just true informed medical decision making. And it's so painful and they're grieving, but there's also a profound sense of peace that comes with understanding what all has gone into that decision. And, then they're sad, of course, but they're not angry. They're not haunted by that decision. They're not feeling like the hospital killed their loved one. And so, if informed decision making can make such a difference at the end of life, of course, it makes so much of a difference all the life through. And to my point, there's always another option. If it feels like you're being presented with one, it doesn't mean that you've reached the end. It just means that that conversation isn't truly finished yet. Carry this brain framework with you. If you couldn't tell, I could talk about this stuff all day long because it matters so much. But I know your time is precious, and so I try to keep these podcasts short on purpose. Here's the thing though. I know that the real breakthroughs don't happen from listening. They happen when you can ask questions and when you can say, okay, but in my situation, what exactly does this look like? That's exactly why I host the live off script strategy hour every Thursday night at 6 p.m. Eastern. We'll talk through this week's podcast topic in a bit more depth, workshop some real examples, and figure out how it makes sense in your world, not just in theory. Then we have open Q&A, and you can literally bring whatever's going on for you, whether it's the confusing test results, the doctor who won't listen, or the I don't even know where to start stuff. Bring it, and I'll help you make sense of it. So if you've ever just wished that you could pick my brain for a few minutes, this is your chance. Go to Facebook, find the group Breaking the Referral Loop, hit join, and I'll see you Thursday night. Because this is where you stop chasing doctors and start getting answers.